Welcome to the Ultimate Personal Training Podcast. In today's episode, we're going to be talking about the interaction between our nutrition, supplementation, and pharmacology. So, this is a discussion for not every single personal training client that we have, because some clients won't apply to the pharmacology or the supplementation thing. And when I say pharmacology, a lot of people, when you think about personal training and building muscle, etc., they think PED, so performance enhancing drugs. This is overall pharmacology in terms of everything that medicine has led to us. And yes, PED is a part of that, but we're also looking at normal medications as well. And this fits into the health issue, the optimal health, and the performance bracket. Okay, so each of these things need to be factored in when looking at any of these particular conditions. So if you're looking at a health condition, first of all, depending on the severity of the health condition, we probably need to look at pharmacology. If someone has ridiculously high blood pressure or someone has another health condition that is actually very detrimental to them, it's probably a really good idea for them to see the doctor and get some properly prescribed pharmacology to allow them to be able to handle that condition and mitigate the risk. Okay, so if someone's a type 1 diabetic, they really can't manage that without using pharmacology because their pancreas doesn't produce any insulin whatsoever. So no matter how good we are with our nutrition protocols or with our supplementation protocols, we're always going to fall short and that person's going to die very, very quickly. So when trainers, or in particular alternative health practitioners, really start ripping in the pharmaceuticals and pharmacology as being something that's bad, I think it's really naive. I get part of what they're trying to say. There is an over-reliance in some circumstances in pharmacology, but it's certainly saved more lives than one's damaged. We need to be aware of that. If we go to supplementation falls into the same bracket as pharmacology. It's weaker pharmacology. And a lot of the time when someone goes to see a naturopath or another functional medicine practitioner or someone alternative, they'll leave with a bucket list full of supplements to do the same things as one medication. So it's not that either or are bad, because pharmacology will generally be more effective but have more side effects because it is a more powerful system. And then supplementation will have less positive effects, but also less side effects as well. It doesn't mean it's totally absent of that though. And that's one thing that a lot of people don't really consider, that some supplements, so for example, ashwagandha has been found to trigger depressive symptoms in quite a significant audience of people who may be taking it. So we need to be a little bit smarter with all this stuff. Now, nutrition is the linchpin for a lot of things that underpins anything that we're trying to do with our clients. And this is where we should be starting with. We should be looking at making sure our clients have fundamental nutrition knowledge and fundamental nutrition habits for them to get the outcomes that they want to get from their lifestyle transformation programs. If someone is not eating well, it will eventually lead to declining rates of optimal health. It will lead to declining performance, and it will lead to health conditions. There's really no way that we can argue against this topic. For example, if someone has no vitamin C, they will get scurvy. It's undebatable at this point. So we need to be aware of all three of these things and how each of these things interact when a client is doing stuff. So a really common example is not having grapefruit juice when someone is on certain medications, because it affects the rate of breakdown and absorption and excretion of that particular medicine and can actually be quite bad for that person. That shows that something like a simple food, a grapefruit, can actually have some really powerful effects when combined with pharmacology. Recent studies have shown that having bananas with blueberries basically inactivates all the antioxidant benefits of blueberries and can potentially also inactivate all the pain-killing properties of aspirin. So this nutrition stuff gets more complicated the more we go on and the more things that we learn. So what do we want to do with this information? That's the most important thing here. Now, there's a number of things we can do. The first thing is when we're looking at our clients and they're coming to us with a combination of health conditions, a desire for optimal health and performance goals, we need to have a different approach for every single one of those categories with an understanding of how that impacts on the ones below it. Okay, so if someone that comes to us with health conditions, we need to know what foods or supplementation and what pharmacological interventions they are using and the potential impact on them on everything that they're doing. So if someone's on antidepressants, for example, because of a health condition, because that's a mental health condition, we may find that they have a harder time sticking to a diet plan. We may find that they have a larger than normal appetite. That's one thing that could potentially happen. So we need to be aware of that. When someone's trying to get to optimal health, we may be looking at increasing their amount of vegetables and looking at their amount of antioxidants in the diet and their protein intake and then their supplementation. And then they might actually be removing themselves, with the advice of their doctor, from their pharmacology because their health is getting more optimal. When we're looking at performance, we need to look at what nutrition fuels optimal performance. Hint, it's not keto. what supplementation can lead to it, such as our creatine, our beta-alanines, caffeine, etc. And then also how pharmacology can increase or decrease performance, because you are going to come across clients who use PEDs. You are going to come across clients who are on beta blockers. You're going to come across these things. You have very little options but to know about them and how they potentially impact. This doesn't mean that you're diagnosing, that you're performing medicine, that you're going outside the scope of practice. You're simply aware. And when you're aware, you can make better decisions for your clients and you can make better decisions for yourself to get them better outcomes. So guys, make sure when you're doing this, take it seriously. And when you're working with someone, make sure you have a look into the health conditions that they have, their optimal health outcomes, their performance, and understand how pharmacology, nutrition, and supplementation do that. It's exactly what we teach in our mentoring program. Thanks heaps. I'll see you soon.